Nasal septum deviation. Nasal septum. The thin wall between the nostrils is made of cartilage and bone, and is called the septum. The septum separates the nostrils. Typically, it sits at the center and divides the nostrils evenly. Nasal septum deviation. A deviated septum occurs when the nasal septum is significantly displaced to one side, making one nasal air passage smaller than the other. A deviated septum occurs when the thin wall, nasal septum, between nasal passages is displaced to one side. Types. Risk factors. Risk factors include playing contact sports, not wearing seat belt while riding in a motorized vehicle. Causes. A deviated septum can be caused by a condition present at birth. In some cases, a deviated septum occurs during fetal development and is apparent at birth. Deviated septum is associated with genetic connective tissue disorders such as Marfan syndrome, homocystinuria and Ehlers-Danlos syndrome. Injury to the nose. A deviated septum can also be the result of an injury that causes the nasal septum to be moved out of position. In infants, such an injury may occur during childbirth. In children and adults, a wide array of accidents may lead to a nose injury and deviated septum. Trauma to the nose most commonly occurs during contact sports, rough play such as wrestling or automobile accidents. The normal aging process may affect nasal structures, worsening a deviated septum over time. Swelling and irritation of the nasal cavities, rhinitis, or sinus cavities, rhinosinusitis, also can further narrow the nasal passage from a deviated septum, resulting in nasal obstruction. Pathophysiology. When a deviated septum is severe, it can block one side of nose and reduce airflow, causing difficulty breathing. The additional exposure of a deviated septum to the drying effect of airflow through the nose may sometimes contribute to crusting or bleeding in certain people. A nasal blockage or congestion, obstruction, can occur from a deviated nasal septum, from swelling of the tissues lining the nose or from both. Symptoms. Most septal deformities result in no symptoms, and patients may not even know they have a deviated septum. Some septal deformities, however, may cause the following signs and symptoms. Obstruction of one or both nostrils. This blockage, obstruction, can make it difficult to breathe through the nostril or nostrils. Patients may notice this more when they have a cold, upper respiratory tract infection, or allergies that can cause nasal passages to swell and narrow. Nosebleeds. The surface of nasal septum may become dry, increasing risk of nosebleeds. Facial pain. There is some debate about the possible nasal causes of facial pain. A possible cause of one-sided facial pain could be a severe deviated septum in which surfaces within the nose touch and cause pressure. Noisy breathing during sleep. A deviated septum or swelling of the intranasal tissues can be one of the many reasons for noisy breathing during sleep. Awareness of the nasal cycle. It is normal for the nose to alternate being obstructed on one side, then change to being obstructed on the other. This is called the nasal cycle. The nasal cycle is normal, but being aware of the nasal cycle isn't typical and can indicate nasal obstruction. Preference for sleeping on a particular side. Some people may prefer to sleep on a particular side in order to optimize breathing through the nose at night if one nasal passage is narrowed. Diagnosis. History taking, history of nose or face trauma, congenital condition. Physical examination, usually a bright light and an instrument that can help visualize the nasal septum by opening the nostril, nasal speculum, will help make the correct diagnosis. Nasal endoscopy. Some deviated septums are deep in the nose and may require further evaluation with a small telescope or endoscope. Imaging studies. Imaging may occasionally be done with a CT scan to view the extent and other associated to findings, but this is not often done. Medical management. Initial treatment of a deviated septum may be directed at managing symptoms. Decongestants. Decongestants are medications that reduce nasal tissue swelling, helping to keep the airways on both sides of nose open. Decongestants are available as a pill or as a nasal spray. But use nasal sprays with caution. Frequent and continued use can create dependency and cause symptoms to be worse, rebound, after stop using them. Antihistamines. Antihistamines are medications that help prevent allergy symptoms, including a stuffy or runny nose. They can also sometimes help non-allergic conditions such as those occurring with a cold. Some antihistamines cause drowsiness and can affect ability to perform tasks that require physical coordination, such as driving. Nasal steroid sprays. Prescription nasal corticosteroid sprays can reduce swelling in nasal passage and help with drainage. It usually takes from 1 to 3 weeks for steroid sprays to reach their maximal effect, so it is important to follow doctor's directions in using them. Nasal strips. Medications only treat the swollen mucous membranes and won't correct a deviated septum. Surgical management. Surgical repair, septoplasty. Septoplasty is the usual way to repair a deviated septum. During septoplasty, nasal septum is straightened and repositioned in the center of nose. This may require surgeon to cut and remove parts of septum before reinserting them in the proper position. The level of improvement with surgery depends on the severity of deviation. Symptoms due to the deviated septum, particularly nasal obstruction, could completely go away. However, any other nasal or sinus conditions that affect the tissues of nose, such as allergies, can't be cured with only surgery. Complications of septoplasty. Nasal septum perforation due to bilateral trauma of the mucoperitoneal flaps opposite each other. Incomplete correction with persistent nasal symptoms. External nasal deformity. Septal hematoma and septal abscess. Scarring inside the nose and nose bleeding. Adhesions and synechiae between septal mucosa and lateral nasal wall. Saddle nose due to over-resection of the dorsal wall of the septal cartilage. Dropped nasal tip due to resection of the caudal margin. Rhinoplasty. In some cases, surgery to reshape the nose, rhinoplasty, is performed at the same time as septoplasty. Rhinoplasty involves modifying the bone and cartilage of nose to change its shape or size or both. Nursing management. Based on the assessment data, the major nursing diagnoses are: acute pain related to surgical procedure, deficient knowledge related to caregivers' understanding of post-discharge home care and signs and symptoms of complications, anxiety related to surgical procedure and unexpected outcome, risk for infection related to surgical incision, situational low self-esteem related to nasal septal deviation. Complications. A severely deviated septum causing nasal blockage, obstruction. It can lead to dry mouth, due to chronic mouth breathing, a feeling of pressure or congestion in nasal passages, disturbed sleep, due to the unpleasantness of not being able to breathe comfortably through nose at night. Prevention. Wear a helmet or a mid-face mask when playing contact sports, such as football and volleyball. Wear a seat belt when riding in a motorized vehicle.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.